Thank you, Ramesh, and thank you to Health Ed for giving me the opportunity to be on this platform. I've actually only prepared 3 slides because today's presentation is actually not about me or my company. It's about you. For those of you in the audience who see dermatology on a day-to-day basis, put your hand up in terms of, do you actually see skin problems? I like a round of hands. Keep your hands up if you feel that dermatology is hard. Keep your hand up if you wish you can actually refer that case instantaneously to a dermatologist. Well, keep on listening, guys, because this talk's for you. So, the title of the talk is Bring Specialist Dermatologists into Your Consultation, and that is exactly what DermScreen aims to do. I started off looking at skin cancer, but we're actually expanding into areas such as rashes, acne, and other aspects of dermatology such as hair and nails. And my role is here to empower you as general practitioners in the audience to better look after your patients so that you don't actually have to refer those patients to the dermatologist, so that you can actually keep the patient within your community. So shout out to the 2 people from Boyne-Brook, 3 hours out of Sydney, 3 hours out of Perth, because for them, their closest dermatologist is in Bunbury, and Bunbury is still over an hour away. So they'd rather send a case to DermScreen than actually have to refer to their local dermatologist. So spare a thought for them. Without further ado, what is the problem here, guys? Well, as you all know, managing skin cancer is a challenge in primary care. Do you have to do those $20,000 worth of skin cancer courses to become proficient? I don't believe you do. All you need is a dermatologist in your pocket to actually refer a case to and fill a short questionnaire, and boom, you've got a patient there that's happy to come back to you, and you can provide them with the advice and guidance that you need to manage that patient. We've got 23 clinics now that we're working with over 150 GPs that use our service on a day-to-day basis. When I was sitting in that exhibition hall over the course of the day, I answered 9 cases from GPs actually seeking my assistance for clinical care. And the reason why is dermatology is hard, you guys are busy, you don't have time to upskill, but let me help you. Let DermScreen help you in your workflow. The other aspect is that a lot of practices are bulk billing and they want to transition into that mixed billing model. How can we, as a private operator, help you to make that transition a lot easier? I've already mentioned the long wait times to see a dermatologist. When we were sitting in the panel today, it was apparently 10 months is actually a very short time, because seeing a psychiatrist with eating disorders is much longer than that. Their books are closed. And finally, managing risk. All of you guys want to practice the best possible clinical care, and the best way to do that is to share the load, and what better way to do that with DermScreen dermatologists. So the solution is a GP support portal, whereby you can actually securely send a photograph with a short clinical questionnaire with a guaranteed 48-hour turnaround. It's using TGA-approved devices with specialist dermatologists ready on hand to support you. And we are indeed first to market and award-winning, and allowing the patient to save time and money. And thereby, for those practice owners out there, we actually allow you to be able to advertise with DermScreen dermatologists here available now in your practice. And what does that result in? Expedited care with fast results, quick turnarounds, patients come back to you, you keep the patient within the community. And in terms of our recent audit that we've been able to show, we've reduced biopsies by 30% from unnecessary biopsies having been performed, so hence reduced time and expense from consumable costs, but also the associated travel that the patient has to do and the wait to see a dermatologist. So I'm at the corner next to the coffee shop on stand 31. Please come to see me. There is a delegate discount conference code that I'll be able to share to you for those that are interested in signing up. Look forward to seeing you, and thank you again for having me here today. Thank you all.